We'll talk first a little bit about general pain, and we're going to talk about supplements first, and I want to talk about some of the mechanisms of why these are important. Now, some supplements you want to take on a regular basis. So I'm going to highlight omega-3 here first. Omega-3, this is one that's so deficient in so many people's diets because most people don't eat enough cold water fish, and a lot of you probably aren't eating, if you aren't eating enough grass-fed beef or grass-fed meats, and some of you, if you're buying conventional meat, you're not getting the omega-3 that you need. And so understand what omegas do, especially 3. They regulate inflammation. This is why they're so important. Now, research, I learned this when I worked in the VA hospital in the rheumatology department, it's 21 years ago now. So research showed that omega-3 fats were actually as effective and in some cases more effective at mitigating pain than non-steroidal anti-inflammatories. So if you take drugs like ibuprofen or even aspirin, there's Celebrex and naproxen and a number of what are called, again, non-steroidal anti-inflammatories, NSAIDs, if you will. When compared to omega-3, they're not as effective for several reasons. One, omega-3 naturally regulates the inflammatory response. So we want that natural regulation more than we want that synthetic inhibition, because the synthetic inhibition causes folate, vitamin C, and iron deficiency. So one of the problems with that, if we're talking about general pain, especially as it relates to your joints, is folate, one of its primary roles is in the formation of cartilage. Same thing with vitamin C, it's in the formation of collagen, which is very important. If you're deficient in these nutrients because you've been trying to synthetically reduce your pain this way, you end up here with weaker collagen. You end up with an inhibition on your cartilage formation, which of course is going to increase the risk for the development of arthritis and other types of pain. And of course, iron deficiency leads to anemias. And so one of the sources of generalized pain is reduction of oxygen, O2. Remember, anemia, which is a lack of the ability to carry the oxygen through your red blood cells to your muscles, your tendons, your joints, etc. You don't want that anemia because that lowered oxygen level will increase lactic acid production. Now, if you've ever gone to the gym and worked out and your muscles burned because of this formation of lactic acid, some people have that pain, that lactic acid pain all the time because they're anemic. This is one of the reasons, again, why anemia can cause chronic generalized pain. So again, if you're manipulating your pain with these over-the-counter or even in some cases prescription drugs, this is the consequence. You don't want that. This is where omega-3 plays a major, major role. Again, studies show that it's as effective as these others, but you got to get the quantity right. So, 2 grams per day, and it should be what you take, you want to make sure has a lot of EPA in it. A lot of the omega supplements focus on DHA. DHA right now is very popular because DHA, what we sometimes call brain fat, a lot of people are taking it for cognitive function. A lot of people are taking it for Alzheimer's prevention. And so a lot of the products, these over-the-counter products, they have a lot of DHA, but they're lacking EPA. So you want one that is a good combination of EPA and DHA, 2 grams a day. And this is something that I personally take every day. I take 2 grams of omega-3 every day supplementally in my diet because I'm not a big fish fan. I just don't care for the flavor or the taste. And so again, this is something I would recommend every day. Now, if you're looking for something that's gluten-free, check out Omega Max. If you don't have a gallbladder, check out Ultra Omega. These are our 2 formulations that we recommend that are concentrated EPA, DHA, gluten-free, and one designed again for just general health. The other one designed for people that don't have a gallbladder because of the fat malabsorption issue, where we add some enzymes in it to help that absorption of that omega-3. So omega-3, in my opinion, one of the top that everyone with chronic pain or general pain should be using just supplementally to get that inflammatory regulation control. So next, I want to jump into So I want to talk about vitamin C and quercetin. These two specifically, you want to combine them. You want to combine them because together they work synergistically. In other words, if you're taking just one by itself, it won't work as well. So combining vitamin C and quercetin, when you do that, the biochemistry of vitamin C and quercetin, it works in the same area of the cells as steroids. So if you've ever heard of somebody taking like a corticosteroid for pain, sometimes like prednisone would be an example of that. Vitamin C mixed with quercetin works. It's a similar mechanism. It works on the same chemical. And a lot of times what we do clinically speaking is we put people on high doses of vitamin C and quercetin to help them when their doctors wanting them to wean off of their corticosteroids, we'll use these two to help them do that. But combining these two can be very, very effective for pain, especially inflammatory pain of your joints and of your muscles. Now, if you're taking drugs like corticosteroids, you also want to be aware that they deplete vitamin C. So again, here's the irony, is that the steroid itself actually depletes one of the very nutrients that could help you regulate your pain. But not just vitamin C, also they deplete calcium, they deplete vitamin D, they deplete magnesium. And I'm talking about long-term use. I'm not talking about if you used used it for a week. Some people go on like what's called a steroid dose pack for a week, and they start at a high dose and taper down. I'm talking about long-term use. People that are in chronic pain, that are in pain management clinics, and their doctors have them on kind of a consistent corticosteroid or prednisone indefinitely. If you do that, you're going to end up with these major nutritional deficiencies. Now notice here, magnesium is one of those things on the list for pain, and so is vitamin D. So again, the corticosteroids, they actually inhibit 4 of the nutrients that are on our top list for helping your body manage and regulate inflammation and pain. So it's important that you understand that, especially if you're on these drugs, because if you're on these drugs, you should be supplementing with all of these nutrients just to offset what the drug is doing, not even necessarily for the pain, but just to offset what the medication can actually do. So back to, again, vitamin C and quercetin work synergistically. You want to combine them. When we're talking about quantity, a good starting place for vitamin C is about 5 grams for adults, and that's per day. Now what you want to do with that 5 grams is you want to split it up in divided doses, because if you take 5 grams of vitamin C all at once, 1, it might give you loose bowels or diarrhea. 2, you're not going to absorb it as efficiently. So anytime you go higher than 1 gram at a time when you're taking vitamin C, the absorption rate of that goes down. So when you take a gram, for example, you'll absorb about 600 milligrams, which is 60% of that. So when you're taking vitamin C in high doses, a lot of it is lost and you're not absorbing it. So this is why you want to use divided doses. So when you take a gram 5 times a day, you're going to get the maximum amount of absorption. Because if you take it in those higher multi-gram doses, what will end up happening is you'll lose that absorption of that vitamin C. Now the quercetin, 4 grams per day. Now if you're going to do this long, I don't recommend quercetin at 4 grams a day long term. This would be more for like an acute type of situation where you're trying to get some relief. But 2 grams a day long term would be okay, but you start getting into the higher doses and there's some things that we start to get concerned about. And so if you're taking high doses of this over long periods of time, it's a good idea to be monitored by your doctor. So let's move into the next one, which is vitamin D. Now vitamin D is super critical for a lot of different reasons as far as pain is concerned, but one of the biggest reasons with vitamin D deficiency causes muscle pain. I mean, this is a very well researched and very, very clinically very well proven. And so vitamin D deficiency all by itself can be a contributing factor to muscle pain, also to neuropathy. So if you're having neurological pain. Now, this is something that's super easy to check. There's a test you can ask your doctor to run, and that's called a 25-OH-D test. And so basic blood work, your insurance should cover it. You know, reference range usually on these tests is 20 to 100. A lot of times people will be in their 30s, low 40s on a test like this. This is too low. If you're in chronic pain, this is too low. And you want to get that up. You want to get, ideally if you're in chronic pain, you want your level of vitamin D to be between 70 and 100. And so to accomplish that, you know, most adults are going to need somewhere between 8,000 and 10,000 international units daily. A lot of doctors are hesitant to prescribe vitamin D in adequate doses because there's this myth that because it's fat soluble, it's somehow toxic. And vitamin D, there's, to my knowledge, one case of reported toxicity, and that was an actual PhD nutritionist who was taking 1 million units of vitamin D a day. I believe it was for about a year. This is nowhere near 1 million units a day, and it's a very, very safe dose unless you have kidney disease. If you've got active kidney disease or active scleroderma autoimmune disease, then you want to talk to your doctor about your vitamin D needs. But if you don't, it's perfectly safe and perfectly fine to take 8 to 10,000 units IU per day, and then have your D levels checked. Again, have those D levels checked in about 3-month interval to make sure that you're getting up to this 70 to 100 range. And once you're in that range, it's a lot easier to maintain it. You don't need these heavier doses to maintain it. But remember, one of the things about vitamin D is that inflammation depletes it. Your body burns through more vitamin D when you're inflamed. This is why a lot of times we'll see people with rheumatological arthritis or chronic pain arthritis, their D levels are so low because their body is using every ounce of vitamin D that it has in order to help put this inflammation into check. So people with chronic inflammation, and there's a test, if you're not sure whether you have chronic inflammation, I mean, being in pain is a pretty good indicator, but there's a test that you can ask your doctor to run. It's called a CRP, specifically HSCRP, that stands for high sensitivity C-reactive protein, and you really want this value to be at 0.9 or less. And if your CRP numbers are 3 plus, then that you're not going to correct your vitamin D with anything under this amount. Because I see a lot of doctors prescribe it, and they'll give like 2,000 units a day, and then they'll come back and recheck the vitamin D, and it's exactly the same. It didn't do anything to their vitamin D. It's because this person being chronically inflamed is not going to get a good correction because that inflammation will drive vitamin D lower and lower and lower. So vitamin D, very, very effective. You can get your levels tested, super easy to do. Ask your doctor. It's not a test that doctors oftentimes refuse people of. So there are a lot of the nutritional testing that I've recommended that you hear me talk about, doctors refuse to do. This is not one of those. This is one that it's very easy to get it done. Your insurance will pay for it as well. So get it checked. If you're in chronic pain, again, you want your vitamin D levels checked. Because again, it's something easy to do. CRP is something that's also easy to get them to order. So vitamin C, vitamin D, quercetin, we've talked about omega-3. Let's go on to turmeric. Now, turmeric is very effective anti-inflammatory. And one of the things I like about turmeric is the lack of really any significant side effects. Now, you can go too high of a dose. Certainly, some people take it too far for too long, and that's possible. Some people report stomach irritation with too much turmeric, but that's pretty rare as far as it goes. Now, if you're looking at meaningful dose, anywhere between 500 milligrams a day and 2,000 milligrams a day. And this again, this higher dose, I'm just be clear with all of you, it's not for long-term use. If you're in chronic pain, remember, you can use natural things to help with it, but ultimately your goal should be find the source. right? What is driving the inflammation? What is driving the pain? Now, if it's not trauma, right? Because trauma sometimes is the source of the pain. So you might sprain or strain something or pull a muscle, or have again, a traumatic injury. But, barring trauma, so again, trauma is a really good time to use some of these higher doses of things I'm talking about, because you're trying to, in an acute situation, you're trying to improve the quality of the pain or the quality of your life by helping with the pain. But if you've got a chronic autoimmune inflammatory situation, to stay on this indefinitely as a crutch or a Band-Aid is not the greatest of ideas. You really want to figure out the source of the pain, and we'll talk more about that here in just a minute. Magnesium is another good one, especially for those of you who have cramping or muscle pain. Magnesium is Mother Nature's muscle relaxer, so it can be very, very effective as a muscle relaxer to help reduce cramping and muscle pain. Now, those, a lot of people have that, like leg cramping, shoulder cramping, eyelid twitching. These can all be signs of just physical signs of magnesium deficiency. But magnesium, pretty safe to take for most folks, 600 to 1,000 milligrams a day. Even at these doses, pretty safe to take, especially those of you who might be on certain kinds of medications known to deplete magnesium. Now, I talked about corticosteroids earlier depleting magnesium, but if you're on blood pressure medicines, most of those, the diuretics like hydrochlorothiazide, the Lasix, those types of medications deplete magnesium. And so this is, we see this a lot in patients that have high blood pressure and they've been on their medication for years. We see their magnesium stores really, really low, and that leads to, or can lead to, chronic pain situations that now we're using magnesium to correct what the medicine created, and so that can be very effective. Okay, then we have glucosamine, chondroitin, MSM. I like to combine these three as as a think of it as an all-in-one kind of a thing. Glucosamine, chondroitin can help with collagen and cartilage repair and formation, can help support that. And MSM is an anti-inflammatory, and it's very, very potent as an anti-inflammatory. A lot of people taste the sulfur-containing amino acid, basically, and can work wonders on somebody who's got chronic pain. So I like to combine these three, again, more for acute pain, not for somebody with chronic autoimmune disease, or with somebody who's got chronic osteoarthritis, where they've got a lot of wear and tear on their cartilage. Maybe they've been told that that their cushioning in their joints is narrowed or it's diminished. This would be a really good indication for glucosamine, chondroitin, MSM to be effective.